Assalamualaikum everyone, welcome back to my channel. Today we have with us a very special guest who recently cleared an exam which is very popular among new dental students. Diploma of Primary Care Dentistry, an exam conducted by the Royal College of Surgeons of Ireland. And she is going to guide you guys, prepare you guys and inform you guys about all the tips and tricks, everything which is there to know about the DPCD exam. So first of all, Dr. Farheen, congratulations on behalf of our YouTube family. We are very happy to have you here. Tell us a bit about yourself.
Thank you so much. It's a pleasure to be here. I'm Dr. Farheen Tajammal, a recent graduate. I completed my degree in year 22. I'm currently practicing as an associate dentist at Arizona Dental Practice. I recently completed my diploma in primary care dentistry last month.
Very nice, very nice. So you're a recent graduate and you decided to pursue this exam. What made you take this exam and why not some other exam? Why did you go for the DPCD exam?
Good question. I was always into MFDS exam. I really wanted to pursue that, which was from the Royal College of England, Ireland and Edinburgh. While searching for that exam, I figured out there's an exam offered by Royal College of Ireland, which is Diploma in Primary Care Dentistry. The reason why I chose this exam was after giving this exam, you are exempted from the MFDS Part 1 and you can directly go towards the Part 2 exam. After completing MFD Part 1, you have a time period of 5 years to complete Part 2 exam. I really wanted to get some diploma so that I'm secured towards the part even if I'm not doing Part 2, I have something with me during that time period, because irrespective of any time period, you are already prepared for it. And
this is a very intelligent tip, especially for students watching this, because if you clear MFDS Part 1, you're nothing unless you complete the Part 2 and get the MFDS letters with your name. However, by completing this exam, you have that diploma.
Yeah, I have secured a degree.
Right now, she is Dr. Farheen Tajammal, BDS DPCD RCSI. Is that correct?
Yes,
Yeah,
yes.
That's amazing tip. So, and you can also directly sit for the Part 2 exam of the membership exam.
Yeah,
that's amazing. That's amazing. So now that we have cleared that, taking DPCD exam is an excellent choice for people who are pursuing the MFDS exam or some type of career in the UK. Now, briefly tell us about the exam. How many parts are there? Is this an oral exam, written exam? Can you take it in Pakistan or do you have to go there? So let's start with what this exam is about.
Basically, it's an online exam. It's conducted every a month or two. There's a proper calendar on the website. You can go and check it. Whatever seems comfortable for you, you can book that exam. It's an online exam which is conducted in a time period of 3 hours. Basically, it consists of 2 sets of questions. The first one is 75 MCQs, each with 5 stems of true and false, consisting total 375 MCQs.
375 true and false questions?
Yes.
Oh my god. Okay, that's it?
There is another part which consists of 33 single best answers, each consisting of 5 options.
So around 400 plus questions. And how much time do we have?
We have 3 hours.
3 hours to take this whole exam. So this is not a very easy exam to tackle. So who can take this exam? Who is eligible for this exam? Can someone who recently graduated take this exam or not?
Anyone who has the degree with them can give this exam. This is the eligibility criteria. You need to have a valid passport with you and a degree. This is the important thing. Passport is the most important thing. You need to have the valid ones.
Okay, so if someone has no passport or who hasn't applied for a passport, they should apply for the passport just for the sake of this exam?
I think so.
Oh, okay, this is an important point to know. Okay, so we now have the knowledge of what this exam is about, the format, and who can take this exam. How did you prepare for this exam? Did you take any course? Were the resources available to you? Were you afraid while going in for the exam? How did you prepare for this?
I was definitely nervous for this exam. I did it all by myself. I prepared through my course, which I made by myself. Basically, I did the Pink book, which is the famous Oxford clinical dentistry book. That was enough, and few topics were done from the Blue book, which was anatomy related. and I did some guidelines, which is nice, and BDA guidelines. There are some important 2 to 3 sheets which you need to do before the papers, and a pass test, series of 2 to 3 pass tests. You're good to go after that.
Okay, so we will list all these books in the description. You can see them. How much time did you take to study all of these books and material?
Honestly, I was doing clinic. It wasn't possible for me to have much time. I really wanted to dedicate 4 months to it, which I heard from my colleagues and seniors who had already given the exam. They said 4 months are required, but I took the leap of faith and I did it in 2 months. Alhamdulillah.
Oh, mashallah. You were a very smart student or hardworking student, or both?
Both.
Both. Okay, so you studied smartly
working.
and hardly as well.
Well,
You weren't from the backbenchers, or were you?
no, I won.
You weren't.
I was.
Can a
from-
backbencher take this exam?
Yeah, definitely.
Definitely.
It's not that easy.
With proper guidance, they can.
They can, definitely they can, with proper guidance and with proper course. They need to just dedicate few hours of their day daily to study that guidelines.
And would you say 2 months are enough if you study for the exam?
I wouldn't say for anyone, it depends. Everyone has their own mental
Capacity.
aptitude for it. Some can do it in 4 months. It depends in during how much time period you can retain that basic knowledge.
Definitely, yeah.
And I was a recent graduate. I was familiar with many terms and conditions, and many. I was doing clinic as well, which helped me in guessing all the clinical questions. It really helped me to pass. I was already doing that series of work, which was clinical dentistry. I was doing some cases from it. So it really helped me. I wouldn't say you should be anyone who hasn't studied from many months. They should at least give 3 to 4 months of their time for this exam.
Okay, so you talked about your clinical experience. Would you say someone who is working at a clinic or even in hospitals, if someone's doing house job, would that help them with this exam?
Definitely, because there are many. Basically, this is a clinical exam. It's not a theoretical exam in which you have to cram some things. It's very clinical and very basic. It's of your daily clinical dentistry. It really helped me when I was doing endo. Some questions just came in the paper which was related to the hypo and endo and bleaching. It really helped me clear that thing.
Very nice. So this is a very conceptual exam.
Definitely.
So clinical experience is a plus.
Yeah.
But it's not important, like it's not necessary. You
It's
can
not
take it
necessary.
right after graduation, but if you have some clinical experience, it would help you in your exam.
Definitely.
Okay, so what about the cost of the exam? What was the cost of your exam?
It was around 700 euros, excluding taxes. You need to pay through your MasterCard. You need to have valid MasterCard to pay your online dues. According to PKR and according to any currency, they just deduct some tax.
I see. So what future options do you see after this exam? You have cleared the DPCD exam. You are now a diploma graduate. What would you do in future with this exam? When are your plans of taking the MFDS Part 2 exam?
I have plans very soon to take MFD Part 2. Definitely, I have already gone through it, and the knowledge is very fresh. I really want to do it within a period of 6 months. So let's just pray that I do it soon.
Okay, that is amazing. So any difficulty or complication that you faced during your exam that you were not prepared for during your preparation from your books and stuff, or some other logistic complication that you faced?
I did face a difficulty in registering exam because I really wanted to register it for the month of December, but the seats got all sold out. I have to wait for a period of 2 months. I wasn't sure if I'm supposed to wait. Email many of them, but I didn't get any good response from them. They are very accommodating, but due to the seats which were all sold out, I have to wait for some 2 months. And then they immediately launched a seats of for March, and then I applied for the March exam.
So how much time do you have between registering the exam and the exam date? Is it a fixed time or
it is around a month?
It is around a month. So when you register for the exam, you have roughly around 1 month,
1 month
to take the exam.
The closing date starts a month before the exam.
Anything that you would like to change about your preparation, or like when you took the exam, were you certain that you have passed it, or were there some regrets? Oh my god, I should have studied this or that.
Alhamdulillah, I was a bit hopeful that I'll clear this exam. But the only thing I regret is that I need to cram some anatomy things a bit more, muscle mastication and some more nerve supply, because I got confused during that options while selecting them. So I would suggest to focus a bit more on the anatomy.
I have given the DHA exam, which was an online exam. We had to go to some college and then apply for the exam. How was your experience? Was there a center where you had to visit, or you could take this at home? And what was this whole setup like?
This is a simple setup just required. You can just do it at the comfort of your home. But there are few rulings from them. You need a good desk, a good light, and there are few things marked. There are few checklists which they just launched before the exam, and you need to fulfill that while giving it. And you require a good stable internet connection, of very good network. During my paper, there was some protest going on. I couldn't get a good internet data. I have to change my location. I need to check for the Wi-Fi stabilities. So this really made me stressful, whether I wasn't sure if I could give the exam properly or no. And secondly, you need to have a good laptop with a good speed and RAM to just ace the process of the exam.
Okay, perfect. I think we have covered most of the questions related to the DPCD exam. If you have any more question, you can contact her on the Instagram or check her out on helpingdentist.com. We have made a very easy and affordable course for people who are taking this exam, and this course can help them study for the exam, prepare for the exam better. If you don't want to take a course, we have also listed all the books and material required for the exam, so that you can get guidance from us without paying us anything. But there are some people who need courses or a study partner to prepare for the exams better. So this course would help them prepare for it better. She didn't take any course, I guess.
Yeah, I didn't. I just prepared myself, but I made a course for myself as well.
But you wouldn't want anyone else to go through the same stress that you went through.
Definitely, I would suggest everyone to at least give the mock test. So you are prepared of, you can actually predict what are the question, or you know the form of it once.
So you have prepared mock tests as well for.
Yes, I have.
That's nice. That's nice. And were there repeat questions from the past papers?
No.
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 It was all.
I did past test, but I think there was just one MCQ which was almost similar to it, but it wasn't the exact MCQ.
And would you rate this exam as extremely difficult, extremely easy, or what would be your rating?
I would say it's not easy exam and it's not difficult. It's a kind of neutral exam, but you need to have a good preparation before it just to give it. It's a very clinical based. If you are good at clinics, you can do it in a very fast time period.
When I prepared for the MFDS Part 1 exam back in 2016 or 2015, it made me a better dentist, because the preparation of the exam, studying different guidelines and stuff, you get to know about things which are not very commonly taught to us in Pakistan and India during our
Definitely.
BDS course. So did this exam serve the same purpose for you?
Definitely, it did serve the same purpose for me. I have learned many more things which I haven't knew earlier, like many guidelines. I just got updated with them. So this is a very good exam. It doesn't matter if you are clearing it or no. It just matters what you prepared during that things and what you learned. So I would say it's a good exam that you should give. And I would highly recommend this.
Amazing, amazing. Okay, thank you so much, Dr. Farheen. I think this was very helpful. Candidates who are watching this, students who are watching this, young dentists, fresh graduates, or even people who want to get into the MFDS side of the spectrum, DPCD is a very good entry, getting into the Royal College, getting into their memberships, or planning a career in the UK. So I hope this video was helpful. If you liked it, please share it with your friends who are applying for the UK exams, and let us know in comments if you have any questions for us to answer. Thank you so much. Allah Hafiz.
Thank you.